Welcome to my YouTube channel Exploring Medica. If you like the channel, please subscribe and don't forget to hit the bell so that you will receive further videos. In this video of Hysterical Remedies, you will be knowing what is hysteria and the history of hysteria and the remedies that are indicated in hysteria. The word hysteria is derived from a Greek word hysteria, which is nothing but uterus. Hysteria is a pejorative term used colloquially to mean ungovernable emotional excess and can refer to a temporary state of mind or emotion, characterized by symptoms such as paralysis, blindness, loss of sensation, and hallucinations, and often accompanied by suggestibility, emotional outburst, and histrionic behavior. So now let us try to know the history of hysteria. So earlier, the Egyptians in 1900 believed that womb, that is nothing but uterus, was responsible for affecting the rest of the body. For centuries, whether her symptoms were fatigue, seizures, pain, paralysis, or simply rebelliousness, physicians and philosophers diagnosed countless women with one specific disease. So that one specific disease is nothing but hysteria. In 5th and 4th century, the Greeks, they believed that the problems, that is nothing but hysteria in women, was mainly because of wandering womb, which was mentioned in Hippocratic Corpus. Plato's dialogue, that is Timaeus, considered uterus as a living creature that wanders throughout a woman's body, blocking passages, obstructing breathing, and causing disease. So Aretaeus Cappadocia, they believed that uterus is a living thing inside a living thing, causing symptoms by wandering around a woman's body, putting pressure on other organs, and causing symptoms of hysteria. As they believed that hysteria was because of the wandering uterus, so they tried to send the offending uterus back to its place by placing good smells near the vagina and bad smells near the mouth. In the Hippocratic Corpus, they thought that the uterus wandered in different places of the body, causing pressure to different organs because it was barren and the lady was devoid of sex. So they advised the unmarried ladies to get married for getting rid of hysteria. So marriage was advised as a treatment for hysteria during those days. In the 19th century, Charcot came with the theory that hysteria is a physical affliction of the mind and not of the body, and he treated it by hypnotism. In this picture, you can see Jean-Martin Charcot demonstrating hysteria and its treatment by hypnotism. Early in the 20th century, hysteria was treated by manually stimulating the genitals. As diagnostic techniques improved with time, the number of ambiguous cases that might have been attributed to hysteria declined. For example, before the introduction of EEG, epilepsy was frequently confused with hysteria. Sigmund Freud, a renowned psychologist, claimed that hysteria was an emotional internal affliction that could affect both males and females, which was caused by previous trauma that led to the afflicted being unable to enjoy sex in the normal way. Freud developed psychoanalysis in order to help patients that had been diagnosed with hysteria reduce internal conflicts causing physical and emotional suffering. Coming to present day, female hysteria is no longer a recognized illness, but different manifestations of hysteria are recognized in other conditions such as schizophrenia, borderline personality disorder, conversion disorder, and anxiety attacks. Symptoms of hysteria may range from shortness of breath, anxiety, insomnia, fainting, pains, spasms, convulsive fits, vomiting, seizures, hallucinations, and inability to speak. In homeopathic Medica, we come across several medicines indicated for hysteria. The first and the foremost remedy that we should think about is Ignatia. In Ignatia, we are having bad effects of anger, grief, or disappointed love. Here, the patient broods in solitude or imaginary troubles. My dear friends, I think Ignatia is the drug where every symptom of Ignatia, I feel, they're hysterical. So we can find the contradictory symptoms in Ignatia, that is, the roaring in the ears, emulated by music, the piles, emulated when walking, Sore throat feels ameliorated when swallowed. Empty feeling in stomach not ameliorated by eating. Cough aggravates the more he coughs. Cough on standing still when he is on a walk. Spasmodic laughter from grief. Sexual desire with impotency. Thirst during a chill and no thirst during fever. The color changes in the face when at rest. So continuing further, mental conditions rapidly in an almost incredible short time, changing from joy to sorrow, from laughing to weeping. So we can say that he is a very moody person. Empty feeling at pit of stomach, not ameliorated by eating. Prolapse ani from moderate straining at stool, stooping or lifting. Aggravation when the stool is loose. So usually prolapse of ani is aggravated during constipation, but here in Ignatia you can see that it is aggravated when the stool is loose. The next remedy after Ignatia is Natrum, and Natrum is chronic cough Ignatia. It should be given in the mental state where Ignatia temporarily benefits the symptoms but does not cure. In addition to the sadness, there is hysterical laughter, laughs till she weeps at things not at all ludicrous. The excitement of Natrum is always followed by melancholy. The hypochondriasis and hysteria of Natrum generally go side by side. Continuing with Natrum, in Natrum we are having marked disposition to weep, sad weeping mood without cause, similar to Pulsatilla, but consolation from mothers aggravates her troubles. In Pulsatilla, consolation ameliorates, and in Natrum, consolation aggravates and he becomes irritable. Irritability, the child is cross when spoken to, crying from slightest cause, gets into a passion about trifles, especially when consoled with. So now coming to Actea Racemosa, also called as semicifica. So the causation in Actea Racemosa is anxiety, fright, disappointed love, business failure, overexertion, and childbearing. Here we are having a sense of gloom and dejection as if there was a black pall over everything, showing the appropriateness of this remedy in hysteria and hypochondriasis. Spasms, hysterical or epileptical, reflex from the uterine symptoms, aggravation during menses. All the symptoms of Actea Racemosa are aggravated during the menses. More the flow, more the aggravation. Coming to ASAFOETIDA, a remedy indicated for hysterical and hypochondriacal patients. Hysteria due to sudden suppressed discharges. Globus hystericus, that is sensation as if peristaltic motion was reversed and esophagus was driven from stomach to throat. Hysterical flatulence, changing of moods, fits of joy with burst of laughter. Aggravation in the night, noise in room, better motion in open air, pressure and by touch. Coming to Aurum metallicum, a remedy where you are having constant dwelling on suicide. Here the ailments are after grief, fright, anger, disappointed love, contradiction, and reserved displeasure. There is irresistible impulse to weep in Aurum metallicum, oversensitiveness to all pain, hysterical spasms with laughing and crying alternately, alternation of cheerfulness or of irritability with sadness, anthrophobia, that is fear of people, which is aggravated from emotion, and Aurum metallicum is a syphilitic drug, so all the symptoms of aurum are aggravated from sunset to sunrise. Now let us come to the most sympathetic drug in our Materia Medica, that is Causticum. So here the causations are because of burns, scalds, fright, grief or sorrow, night watching, suppressed eruptions, ulcers, maltreated with lead. The hysterical symptoms in this remedy are that the patient is very amusing or very merriful at sometimes, and soon after there is ill humor. Melancholy and vexatious thoughts day and night with tears, that is hypochondriacal sadness. In hydrocyanuric acid, we have unconsciousness, wild delirium, fear of imaginary troubles, fears everything, that is horses, wagons, house falling, etc. Hysterical and epileptic convulsions. So, Nux Moschata. It is adapted to women and children of nervous and hysterical temperament, similar to Ignatia, marked tendency to fainting fits, changeable laughing and crying, thinks she has two heads. So now coming to Platina, a lady who considers herself to be the queen. For hysterical patients who are alternately gay and sad, who cry easily and hysterical symptoms coming from uterine diseases. So Pulsatilla, a women's remedy, the hysterical symptoms here are involuntary laughter and weeping, fits of anxiety with fear of death or of an apoplectic attack, with buzzing in ears, shiverings and convulsive movements of the fingers, hysterical laughter after meals. Symptoms ever changing, no to chills, no to stools, no to attacks alike. Very well 1 hour, very miserable, the next apparently contradictory. Nervousness intensely felt in the ankles. So coming to the indifferent drug, that is sepia. Paroxysms of weakness and hysterical or other forms of syncope, fainting fits, lassitude. She says and does strange things. Nobody knows what she will do next. Coming to the spider, that is Tarentula Hispanica. The hysterical symptoms here are ameliorated by music. Great excitement from music. She sings until she falls with exhaustion. Her motions are ludicrous and she is even lascivious in her conduct. Fox like cunning and destructiveness. Paroxysms of insanity with restlessness of the leg. So now coming to Moschus. Kent says that Moschus cures many hysterical girls who have come to adult age without ever learning what obedience is. One cheek is red and cold, the other pale and hot. There is certainly some hysterical perversion in the mind of this patient. Sudden attacks of unconsciousness and uncontrollable laughter. So now Valeriana is a hysterical remedy similar to Ignatia where many of the symptoms are hysterical. This remedy cures many nervous and hysterical phenomena in excitable women and children and the complaints of the hypochondriac. Great nervous excitability, exaltation, hysterical contractures, trembling, palpitation, sense of levitation, paroxysmal respiration, stitching pains, tension in the limbs, jerking, twitching, and globus hystericus. So continuing with Valeriana, sensation of something warm rising from the stomach, causing paroxysmal suffocation. All the nerves are in a fret. Oversensitiveness of all the senses, great nervous restlessness, and the symptoms in Valeriana are aggravation during rest and they are ameliorated by motion and moving about. Fainting easily, slight exertion brings on symptoms. Complaints change about, the pains wander from place to place. And in Valeriana, we are having numerous nondescript nervous manifestations that come in spinal irritation when there is amelioration by motion and aggravation by much exertion. Exertion brings on headache, in these cases, stitching pains all over the body during rest. Further in Valeriana, we find hysterical contractures in hands and the arms, crampy darting, tearing like an electrical shock, repeatedly through the humerus, intensely painful, cramp in biceps when writing. So Veratrum is a remedy where there is a state of despair before each menses, never smiles, the world seems blue, everything is dark. Kent says that Veratrum is a remedy that would keep many women out of the insane asylum, especially those with uterine troubles. Girls at puberty suffer with dysmenorrhea, hysterical mental states, diarrhea, and vomiting. So during the menses, they become cold as death, lips blue, extremities cold and blue, dreadful pains, sensation of sinking, mania to kiss everybody, hysteria with coldness at the menstrual period, copious sweat, vomiting, and diarrhea. Nausea with weakness is obliged to lie down, hysterical cramps in the stomach, cramps in the muscles of the abdomen with colic. My dear friends, now let us go through a case of hysteria. A girl aged 16 years fainted in the class that she was attending. So when I examined her, her pulse, BP was quite normal. She had a very good breakfast with her parents just before the class, so hypoglycemia is also ruled out. So now, when somebody faints, we suspect whether there is low BP or there is hypoglycemia, but these things were not there with this girl. What had happened is, her parents who had come to drop her to college from the native place, they just returned back to their place. So as in this case, no physical cause could be elicited. So I considered ailments from grief or disappointment because just now there was acute condition that Her parents went back to the native place, dropping her in Dharwad. So I gave her Ignatia 10m one dose, with which she recovered very quickly. So you may ask why 10m? 10m because she's a young, dynamic girl, and the vitality is very good. And now here at emotional plane, so we can think about a higher potency. Thank you, my dear friends, for staying with me throughout the video. Hope you have liked the video. If you like the video, please don't forget to subscribe and hit the bell so that you will receive further videos. In this video, we have come to know what is hysteria, what are the symptoms of hysteria, how the understanding of hysteria has evolved through the centuries, and what are the drugs that we have for treating hysteria in homeopathic Medica. Thank you one and all.